Where does it hurt? Right here. Oh, it's getting swollen. Effusion. Can you walk?
I think so.
Okay, let's help him up.
Alright, the assessor will do history first, looking for location of pain, asking about onset of pain, the mechanism of injury, consistency of pain, any activities or changes in training techniques, previous history of injury, unusual sensations, altered biomechanics, prior surgery, and foot fixation. For observation, the assessor will first check the patient's gait.
Go ahead and stand up. Walk that way.
He will next take girth measurements to check for swelling.
Go ahead and lay down. On your back.
We'll next check the medial structures, the BMO, looking for swelling and or atrophy. We'll next move to the anterior structures. First, patellar alignment. Check the patellar tendon for swelling. The quadriceps for tone, swelling, and ecchymosis. And the tibial tuberosity for any abnormal enlargement bilaterally. Any kinds of patellar malalignment could include patellar tendon length, patella baja, patella alta, squinting patella, and frog-eyed patella. Tibiofemoral alignment will also be assessed, and Q angle.
If you're measuring Q angle, you want to measure it from the ASIs and down to the tibial shaft. And then you look at this degree right here. Got it?
Got it.
He will next observe standing leg length difference.
Go ahead and stand up. Face me.
Foot posture, and any areas of scars. Next, he will look for genu varum, genu valgum, and genu recurvatum. He will also assess the lateral joint line for swelling and discoloration, the fibular head, and the posterior sag of the tibia, which could indicate a PCL tear. Of course, all of this observation would be done bilaterally.
For palpation, the assessor is going to first palpate the medial structures, the joint line to rule out meniscal pathologies, the medial femoral condyles, the medial tibial plateau, the pezanserine tendons, and then they would move to the anterior structures, the patella border and poles, the tibial tuberosity, the patellar tendon, the patellar femoral bursa, the patellar fat pads, patellar articulating surface, femoral trochlea, retinacular and capsular structures, and synovial plica. They would then move to the lateral structures and palpate the lateral joint line to rule out meniscus pathology, the fibular head, the lateral collateral ligament, the popliteus, biceps femoris, IT band. And for the posterior structures, they would
And look down.
palpate
Roll over.
the popliteal fossa and the hamstrings up to the ischial tuberosity. Next, the assessor will test the range of motion for flexion,
So bring you all the way up.
that's active range of motion,
Let me do it.
passive range of motion,
Resist me. Go ahead.
and resistive range of motion. Next, he will test extension for active, passive, and resistive.
Forward. Let me do it. Guess resistance.
Next, he'll do active, passive, and resistive range of motion for internal rotation.
Go ahead and sit down. Internally rotate foot. Okay, you do it. Resistance. Slightly rotate it. Okay.
Now he's doing external rotation.
Against resistance.
Checking for intercapsular and extracapsular swelling, you perform a sweep test and a milking test, as well as a patellar balloon test. Next, we go into the ligamentous instability tests. For the ACL, we perform the anterior drawer, looking for any non-normal laxity. Next, we do the Lockman test with 15 to 20 degrees of flexion. Next, we'll go on to the PCL and perform the posterior drawer for any posterior laxity. We will next perform the posterior sag test, looking at the tibial tuberosities, seeing if one sags back further than the other. The MCL will be tested next at valgus stress at 0 and 25 degrees. The 0 degrees is checking for more for the capsule, whereas the 25-degree flexion is checking the MCL itself. And then same with the LCL for the bear stress at 0 and 25 degrees. Each of these ligamentous tests will be completed bilaterally. Next, we will be performing the rotary instability tests of the knee. First test will be the Slocum drawer test with an internal rotation of the foot, checking the anterior lateral capsule. Followed up with the Slocum drawer test with external rotation, checking the medial anterior capsule. The reverse Slocum drawer test, pushing back on the tibia with the internal rotation of the foot, which is checking the posterior medial capsule. And then doing the external rotation, checking the posterior lateral capsule. Next, we will do a crossover test. For this test, You leave the involved leg planted on the ground, with the uninvolved leg coming over in front of your involved leg. Checking the anterior lateral capsule, and then next we do leave that same foot planted and go behind with the uninvolved side, checking the posterior medial capsule. Next we will be performing the meniscal pathology tests. First test will be the McMurray's test, checking for any popping, clicking, any uncomfortable sensations. And following that will be the Apley's compression.
Flip over.